We also have with us Dr. Anand Utture joining us. He's a consultant urologist at Fortis Raheja, also at several other top hospitals here in Mumbai. Dr. Anand, let me begin by asking you the most common thing. Why is it happening so much in Gen Z and millennials? I'm trying to understand. Sedentary lifestyle can't be the only reason, right?
Good morning, everybody. The main reason is dehydration, that is ingestion of less water. Ideally, you should have 2 to 3 liters of water every day. And that water should not be morning 1 liter, afternoon 1 liter and evening 1 liter. You should have 1 to 2 glasses of water every 1 to 2 hours so that the kidney remains hydrated.
I see.
Next
so consistent intake of water,
Yes.
not at one go.
Yes, correct.
Okay.
Next is the dietary intake. What has happened is the fast food, which is too much into meat, red meat, something like say, which is 240 grams a day, can lead to uric acid formation. The colas, tea, coffee, brinjal, then seedy vegetables.
No, hold on. I'm having coffee right now.
Yeah.
When doctors say tea, coffee leads to it, I always want to check how much. It's not like 1 glass of or 1 cup of coffee is going to lead to kidney stones, right?
1 in the morning and 1 in the evening should be good enough.
Yeah.
But there are a lot of people who are working, especially the Gen Z that what we are talking about, constantly sipping of coffee. Now this causes a bit of dehydration part because it is also something called as a diuretics to the kidney, because of which you keep on passing urine. So if it is not replaced by regular water, what happens is all the salts come together and there is a metabolic imbalance which happens at the level of the kidney tubules. So the electrolytes gets precipitated, they form the salts, they form the crystals, they grow into stones and the stones start growing. So most important thing is the water, and water intake is the most important thing.
So essentially the takeaway here is drink loads of water. Dehydration could be a major cause and that should be solving some problems for people. But doctor, I've also understood kidney pains, the little experience I've seen in my family, it can get really bad. Like women have compared it to going into labor, being as bad as that. Those were the words of my mother-in-law who told me once it was so bad she was reminded of her labor. But how do you tell? But it takes a long time to understand what's causing the pain. Is there a distinct feature of the pain that tells you that this is probably a stone?
You're absolutely correct here. This pain can be second worst pain after delivery pain. That's what the studies have shown. Now, this pain starts at the level of the kidney, which we call it as the renal angle, and we classically call it in medical terms as loin to groin pain. It starts in the back and comes
Loin to groin
loin to groin pain.
Huh.
That is the kidney situated behind. So the pain starts in the behind in the rib cage and starts coming towards your urethra or your testes. So it's a very classical pain which we call it as a loin to groin pain, which is usually associated with nausea and vomiting. Always look for any discoloration of urine in the form of maybe red color in the urine, which we call it as an hematuria. Because if the stone touches any part of the kidney, ureter or bladder, what happens is it causes a bit of bleeding in there and the color of your urine can change.
Up against.
Yes.
Yeah.
So whenever you have these kind of problems, never neglect them. Always do a sonography, which is available in every nook and corner of city. And you can very well diagnose a problem of the stone. Because these problems of the stone are not only causing this kind of pain and hematuria or bleeding, it can cause problems to the kidney because the pressure which is induced by the stones, which we call it as a back pressure changes. And many a time we see that if the stone's pain is neglected, stone remains there in the body.
Is this kidney stone pain frequent or does it happen at regular intervals? That's the reason why people might say ignore it. It could be several other things in your organ that's causing the pain, right?
Let us understand the mechanism of kidney pain. The stone never causes pain. The stone, when from the kidney comes down and gets stuck into a tube which is called as ureter, that is the time the pain, the kidney gets full, the capsule gets stretched, that's where the nerve endings are and you start getting pain. Now, whenever small amount of urine starts passing by the side of the stone, the pain gets relieved. So, it is an intermittent pain and very excruciating pain. So, once anybody gets a kidney stone pain, as you have said, nobody can forget that this is a kidney stone pain.
All right, which brings me to the next question. Then what is the treatment available then?
Nowadays, first thing what we have to understand is that once a stone former can always be a stone former. So the prevalence rate,
meaning
yes,
it could be hereditary.
It can be hereditary, it can be genetic predisposition. And once you form a stone, there is a possibility that every year you have
coming back.
Yes, 7% chance of having these stones.
Gosh, huh.
So at the end of 5 years, you're looking at about 50% of recurrence of the stone. So whenever you offer treatment, it is always minimally invasive or non-invasive. What we call it by non-invasive is that there is no, it's not going to be any cut or stitch on the body. What we do is we do something called as a lithotripsy, which is the electrohydraulic or electromagnetic waves, which go inside, break the stones and clear into powder form. There is a complete game changer equipment which has come up in last 3 to 4 years time. That's we call it as a flexible ureteroscopy or RIRS, retrograde intrarenal surgery. As the word suggests, retrograde it is, we go from the urethra. It's like a small tubular thing which we can change its direction, go
I
inside
think we
the
have
kidney.
a graphic representation of that. I'll request my producers to put that up on the screen as well. Yeah.
And it does go and looks at the stone, and through that we have got a channel through which we go inside and break the stone with the lasers. Now here what we are showing is, this is latest equipment which has come into market, which is available for last 1 to 2 years. This is, we call it as a classical stone cone. Now what happens is, whenever you are treating the stone can get migrated back into the kidney. So what we do is, we have the stone cone on top of the stone, and then we go with the scope. Now this is what we are showing here is a rigid ureteroscope through which we have put in a small laser fiber, and with the laser fiber we are pulverizing or breaking the stones. The idea is to break the stone into less than 2 to 3 millimeter particles so that it can pass on its own. Now with this stone cone, what we can do is, when you are pulling down the stone, we can regularly break the stone. Now here what we are showing here is, this is the flexible ureteroscopy. That's what it is in there. This is the laser fiber which is coming in there, which is breaking the stone into small fragments.
How fascinating. I'm sure there is so many of these things but precaution is better than
Yes,
cure, right?
the take-home message should be always that prevention is always, yes, stay hydrated, don't eat junk food, don't eat processed meat. See to it that the salt intake, sodium is very less in your body, because that is what is going to cause at the level of the tubules metabolic changes, because of which there is more of excretion of proteins as well as salts, which are going to come together and form small fragments, and over a period of time they are going to grow in size.
Right, and also stay fit.
Stay fit.
Yeah.
Most important.
Get exercising.
Yes. In fact, too much exercise or too less exercise, going into this dietary fads in the form of ketogenic diets or protein shakes, etc., they also lead to this stone formation.
I'm very glad you mentioned that, because we did a full episode only on how much exercise is too much exercise, and I'm so glad doctors are now openly addressing these as well. Dr. Anand, thank you so much for joining us.
Thank you very much.